What if your doctor could predict serious health problems years before symptoms appear, just by examining 7 specific body parts during your routine checkup? In the next 15 minutes, I'll reveal the exact 7 body parts that doctors examine first to assess your longevity and catch life-threatening conditions early. These aren't complex medical tests or expensive procedures. They're simple areas of your body that reveal critical health information most people completely ignore. The 7th body part will shock you because it's something you see every day but never realized could save your life. 3 months ago, 71-year-old Vivian from Seattle went for her annual physical feeling perfectly healthy. During the exam, her doctor noticed subtle changes in 2 of these 7 body parts that I'm about to show you. Those early warning signs led to tests that revealed blocked arteries, potentially saving Vivian from a massive heart attack. Body part 1. Your eyes. Windows to cardiovascular health. The first body part doctors examine can reveal heart disease, stroke risk, and diabetes years before you feel any symptoms, yet most people only think about their eyes when vision problems develop. Research from Harvard Medical School shows that examining the blood vessels in your retina provides direct insight into the health of blood vessels throughout your entire body, including those supplying your heart and brain. When doctors look into your eyes with specialized equipment, they're actually seeing the only blood vessels in your body that can be observed directly without invasive procedures. These tiny vessels mirror the condition of arteries in your heart, making your eyes a crucial window into your cardiovascular health that can predict heart attacks and strokes years in advance. The retinal examination reveals specific changes that indicate serious health problems developing silently throughout your body. When blood vessels in your eyes show signs of narrowing, bleeding, or abnormal branching patterns, it signals that similar damage is occurring in blood vessels supplying your heart, brain, and kidneys. According to the American Heart Association, people with certain retinal vessel changes have a 70% higher risk of developing coronary heart disease and a 40% increased risk of stroke, even when they have no other symptoms. These eye changes often appear 5 to 10 years before traditional risk factors like high blood pressure or cholesterol problems become apparent through standard blood tests. Beyond cardiovascular disease, your eyes reveal early signs of diabetes that can prevent devastating complications if caught early. Diabetic retinopathy begins damaging blood vessels in your eyes long before you experience vision problems or even know you have diabetes. The Centers for Disease Control reports that regular eye examinations can detect diabetes-related changes up to 7 years before symptoms develop, allowing for early intervention that prevents blindness, kidney disease, and nerve damage. When 67-year-old Kenneth from Portland had his annual eye exam, his optometrist noticed tiny hemorrhages that led to diabetes testing. Early detection allowed Kenneth to control his blood sugar through lifestyle changes, preventing the serious complications that affect millions of undiagnosed diabetics. The solution for protecting your health through eye monitoring is straightforward and accessible to every senior. Schedule comprehensive eye examinations annually with an optometrist or ophthalmologist who will dilate your pupils and examine your retinal blood vessels thoroughly. Between professional exams, perform simple daily eye checks by looking at yourself in good lighting and noting any changes in the whites of your eyes, unusual redness, or vision changes. Cover one eye at a time and test your vision by reading text at arm's length, checking for any differences between your eyes or changes from day to day. Pay attention to sudden vision changes, flashing lights, or dark spots that could indicate serious problems requiring immediate medical attention. Don't wait for vision problems to develop. Schedule your comprehensive eye exam this week because early detection through your eyes can prevent heart attacks, strokes, and diabetes complications. Body part 2, Your fingernails, silent health messengers. Did you know your fingernails can reveal heart disease, lung problems, and serious nutritional deficiencies that could be silently threatening your life right now? Your nails grow continuously and reflect your internal health status through changes in color, shape, thickness, and growth patterns that most people dismiss as cosmetic issues. Research from the Mayo Clinic demonstrates that fingernail abnormalities often appear months or even years before other symptoms of serious diseases become apparent. Doctors specifically look for nail clubbing, color changes, ridging patterns, and growth abnormalities that indicate problems with your heart, lungs, liver, or circulation that require immediate medical attention. Nail clubbing, where fingertips become enlarged and nails curve downward around the fingertips, is one of the most serious warning signs that doctors look for during physical examinations. This condition indicates chronic low oxygen levels in your blood, which can result from heart disease, lung disease, or liver problems that are slowly progressing without obvious symptoms. According to pulmonologists at Johns Hopkins, nail clubbing appears in 80% of people with certain types of lung cancer and heart disease, often developing 6 months to 2 years before breathing problems or chest pain becomes noticeable. The clubbing occurs because your body is trying to compensate for inadequate oxygen by increasing blood flow to your fingertips, causing the characteristic bulging appearance that signals serious internal problems. Color changes in your nails provide crucial information about your circulation, nutrition, and organ function that can prevent life-threatening complications. Pale or white nails often indicate anemia, liver disease, or heart failure, while bluish nails suggest poor circulation or lung problems that require immediate medical evaluation. Yellow nails can signal fungal infections, thyroid problems, or lung disease, particularly when accompanied by thickening or slow growth. When 73-year-old Marianne from Dallas noticed her nails becoming increasingly pale and brittle, her doctor's examination revealed severe anemia caused by internal bleeding that required urgent treatment. Examining your nails regularly provides an early warning system that could save your life through simple daily observation. Look at your nails in good natural light every week, checking for changes in color, shape, or texture compared to how they normally appear. Press on your nail beds and watch how quickly the pink color returns. Slow return of color indicates circulation problems that need medical attention. Notice if your nails are growing more slowly than usual, developing ridges or changing shape, particularly any curving or clubbing around your fingertips. Keep a simple record of any changes you notice, including when they started and how they're progressing, to share with your doctor during routine visits. Examine your nails right now and don't ignore any unusual changes because your fingernails might be trying to save your life by revealing serious health problems before they become critical. Body Part 3. Your skin. Your body's largest warning system. Your skin reveals circulation problems, diabetes complications, and heart issues long before blood tests show abnormalities, making it one of the most important diagnostic tools for detecting serious health problems early. As your body's largest organ, your skin receives blood supply from the same vessels that feed your heart, brain, and other vital organs. So changes in skin appearance directly reflect the health of your entire circulatory system. Research from Johns Hopkins Dermatology Department shows that specific skin changes can predict heart disease, diabetes, and stroke risk with remarkable accuracy, often appearing 2 to 5 years before traditional symptoms develop. Doctors specifically examine skin color, temperature, texture, and healing patterns to assess your overall health status and identify problems that require immediate intervention. Skin color changes provide critical information about your circulation and organ function that can prevent serious complications if recognized early. When your skin becomes persistently pale, particularly around your nail beds, lips, or inner eyelids, it often indicates anemia, heart problems, or poor circulation that needs medical evaluation. A bluish tint to your skin, especially around your lips or fingertips, suggests inadequate oxygen levels that could signal heart or lung disease requiring urgent attention. Yellow discoloration of your skin may indicate liver problems or diabetes complications, while reddish or purple patches can signal circulation disorders or blood vessel problems. According to cardiologists at Harvard Medical School, people who develop specific skin color changes have a 60% higher risk of heart disease, even when their cholesterol and blood pressure appear normal. Temperature and texture changes in your skin reveal circulation problems and diabetes complications that can prevent serious infections and amputations if caught early. Cool skin temperature, particularly in your hands and feet, indicates poor circulation that increases your risk of heart disease and stroke while making you more vulnerable to infections and slow healing. Dry, thick, or scaly skin, especially on your legs and feet, often signals diabetes or circulation problems that can lead to dangerous infections if not addressed promptly. Changes in skin texture, such as increased thinness or easy bruising, may indicate nutritional deficiencies or medication effects that need medical evaluation. When 69-year-old Alexander from Phoenix noticed his lower legs becoming increasingly dry and developing dark patches, his doctor's examination revealed circulation problems that required treatment to prevent serious complications. Monitoring your skin health provides an accessible early warning system that requires no special equipment or medical training. Examine your skin daily during bathing, looking for changes in color, temperature, or texture compared to your normal appearance. Pay special attention to your hands, feet, and lower legs, which often show the first signs of circulation problems or diabetes complications. Check how quickly small cuts or scratches heal, and notice if you're developing more bruises than usual, or if your skin feels unusually dry or itchy. Perform monthly full-body skin examinations in good lighting, looking for new spots, changes in existing moles, or areas that look different from the surrounding skin. Start checking your skin systematically today, because early detection of skin changes can prevent heart disease, diabetes complications, and serious infections that could threaten your life. Body part 4, your tongue, the health indicator you never check. When did you last really look at your tongue, and do you know what a healthy tongue should look like? Your tongue reveals nutritional deficiencies, circulation problems, and systemic diseases that often go undetected until they become serious health threats. Research from Harvard Medical School shows that tongue appearance provides valuable diagnostic information about your overall health status, including your nutritional state, circulation, immune function, and organ health. Doctors specifically examine tongue color, texture, coating, and size to identify problems ranging from anemia and vitamin deficiencies to heart disease and autoimmune disorders that require medical attention. A healthy tongue should be pink in color, with a thin, clear coating and small bumps called papillae that give it a slightly rough texture. Changes in tongue color provide important clues about your internal health that can prevent serious complications if recognized early. A pale tongue often indicates anemia or poor circulation, while a bright red tongue may signal vitamin deficiencies or inflammatory conditions. A white coating on your tongue can indicate dehydration, oral infections, or immune system problems, while a yellow coating may suggest liver problems or bacterial infections. According to nutritionists at the Mayo Clinic, Tongue color changes often appear weeks or months before blood tests reveal vitamin deficiencies or anemia, making regular tongue examination a valuable early detection tool. Changes in tongue texture and size reveal serious health problems that can be addressed effectively when caught early. A swollen tongue may indicate severe allergic reactions, vitamin deficiencies, or thyroid problems that require immediate medical attention. A smooth tongue that has lost its normal bumpy texture often signals B vitamin deficiencies that can cause serious neurological problems if left untreated. Deep grooves or cracks in your tongue can indicate dehydration, nutritional deficiencies, or autoimmune conditions that need medical evaluation. When 75-year-old Charlene from Minneapolis noticed her tongue becoming increasingly smooth and pale, her doctor's tests revealed severe B12 deficiency that was causing memory problems and fatigue. Checking your tongue regularly provides valuable health information that takes less than 30 seconds and could identify serious problems before they become critical. Look at your tongue daily in the mirror under good lighting, preferably in the morning before eating or drinking anything. Note the color, texture, and any coating, comparing it to how your tongue normally appears and watching for gradual changes over time. Stick your tongue out fully and examine the sides and underneath, looking for any unusual spots, sores, or changes in appearance. Pay attention to any changes in taste, burning sensations, or difficulty moving your tongue, which can indicate serious health problems. Look at your tongue right now and make daily tongue checks part of your routine, because this simple examination might reveal health problems that could save your life when detected early. Body Part 5. Your hands, grip strength and longevity predictors. Your hand strength is one of the most accurate predictors of how long you'll live, yet most people never test it or realize its critical importance for health and longevity. Research published in the British Medical Journal followed over 140,000 adults for 4 years and found that grip strength was a better predictor of death from any cause than blood pressure readings or other traditional health measurements. The Mayo Clinic reports that people with weak grip strength have a 40% higher risk of death from heart disease and a 50% higher risk of death from any cause compared to those with strong grips. Your grip strength reflects your overall muscle mass, bone health, nutritional status, and cardiovascular fitness in ways that predict your ability to maintain independence and avoid serious health problems as you age. Declining grip strength indicates muscle loss, frailty, and increased vulnerability to falls, fractures, and serious infections that can be life-threatening for seniors. When your grip strength decreases, it signals that you're losing muscle mass throughout your body, including in your heart, which increases your risk of heart failure and reduces your ability to recover from illness or injury. According to research from Johns Hopkins, people who lose grip strength over time have higher rates of cognitive decline, increased risk of stroke, and greater likelihood of developing diabetes and other chronic diseases. The muscle loss that affects your grip also affects your balance, coordination, and ability to perform daily activities, leading to a cycle of declining function that can be prevented if caught early. Your hands also reveal circulation problems, arthritis progression, and neurological issues that can be addressed effectively when detected early. Cold hands often indicate poor circulation that increases your risk of heart disease and stroke, while persistent swelling may signal heart, kidney, or liver problems requiring medical evaluation. Changes in hand sensation, such as numbness or tingling, can indicate diabetes complications or nerve problems that need immediate attention to prevent permanent damage. When 72-year-old Eugene from Atlanta noticed his grip becoming weaker when opening jars, his doctor's tests revealed early heart problems that were treated before they became serious. Testing and maintaining your grip strength provides crucial health information and can help prevent the muscle loss that threatens your independence and longevity. Test your grip strength weekly by squeezing a tennis ball as hard as you can and noting whether your strength feels the same as previous weeks. Practice simple grip-strengthening exercises daily, such as squeezing a stress ball, using hand grippers, or performing finger exercises while watching television. Pay attention to changes in your ability to open jars, carry groceries, or perform other hand-intensive activities that might indicate declining strength. Notice any changes in hand temperature, color, or sensation that could signal circulation or nerve problems requiring medical attention. Test your grip strength today and start daily hand exercises because maintaining your grip strength is essential for independence, health, and longevity as you age. Body part 6. Your neck. The pulse of life and death. Can you feel the pulse in your neck? And do you know what it's telling you about your heart health and stroke risk? Your carotid pulse, located on either side of your neck, provides direct information about your heart function and the condition of the major arteries supplying blood to your brain. According to the American Heart Association, changes in your carotid pulse can indicate heart rhythm problems, arterial blockages, and stroke risk that often develop silently without obvious symptoms. Doctors specifically check the strength, regularity, and character of your neck pulse to assess your cardiovascular health and identify problems that require immediate medical intervention to prevent heart attacks and strokes. The carotid arteries in your neck are major blood vessels that supply oxygen-rich blood directly to your brain, making them critical indicators of both heart health and stroke risk. When these arteries become narrowed or blocked due to plaque buildup, your pulse may become weaker, irregular, or develop abnormal sounds that doctors can detect during examination. Research from Harvard Medical School shows that people with carotid artery disease have a 5 times higher risk of stroke and 3 times higher risk of heart attack, often developing these problems gradually over years without noticeable symptoms. Changes in your neck pulse, strength, or rhythm can indicate developing blockages months or years before stroke symptoms appear, providing crucial time for preventive treatment. Your neck pulse also reveals heart rhythm abnormalities that can be life-threatening if not detected and treated promptly. Irregular heart rhythms, such as atrial fibrillation, often first become apparent through changes in pulse rhythm that you can feel in your neck before they cause obvious symptoms like chest pain or shortness of breath. According to cardiologists at Johns Hopkins, people with untreated irregular heart rhythms have a 500% higher risk of stroke and significantly increased risk of heart failure. When 68-year-old Beatrice from Denver felt her neck pulse becoming irregular during her morning routine, her doctor's tests revealed atrial fibrillation that was treated before it caused a stroke. Checking your neck pulse regularly provides valuable cardiovascular health information that takes less than 1 minute and could prevent heart attacks and strokes. Place 2 fingers gently on either side of your neck, just below your jawline, and feel for your pulse while counting beats for 15 seconds, then multiply by 4 to get your heart rate. Notice whether your pulse feels strong and regular, or if it seems weak, irregular, or unusually fast or slow compared to your normal pattern. Check your pulse at the same time each day, preferably in the morning before physical activity, and keep a simple record of your heart rate and rhythm. Pay attention to any changes in pulse strength or regularity, and seek medical attention immediately if you notice persistent irregularities or significant changes from your normal pattern. Check your neck pulse right now and make it part of your daily routine, because early detection of pulse changes can prevent strokes and heart attacks that could save your life. Body part 7. Your feet. The foundation of health prediction. The 7th body part, doctors check last, might be the most important because your feet reveal circulation, diabetes, and mobility issues that determine your lifespan and quality of life in your later years. Your feet are the farthest points from your heart, making them the first areas to show signs of circulation problems, nerve damage, and other health issues that can become life-threatening if not addressed promptly. Research from the American Diabetes Association shows that foot problems are leading indicators of serious complications, including heart disease, stroke, and infections that can require amputation or cause death. The Centers for Disease Control reports that people with poor foot health have significantly shorter lifespans and higher rates of disability, making foot examination a critical component of health monitoring for seniors. Circulation problems in your feet provide early warning signs of heart disease and diabetes that can be prevented or treated effectively when caught early. When blood flow to your feet decreases, you may notice changes in skin color, temperature, or sensation that indicate developing problems throughout your circulatory system. Cold feet, particularly when accompanied by color changes or slow healing of minor cuts, often signal circulation problems that increase your risk of heart attack, stroke, and serious infections. According to vascular specialists at Harvard Medical School, people who develop circulation problems in their feet have a 300% higher risk of heart disease and a significantly increased risk of diabetes complications that can be life-threatening. Nerve damage in your feet, often caused by diabetes or vitamin deficiencies, can lead to serious infections and amputations if not detected and treated promptly. When you lose sensation in your feet, you may not notice minor injuries, pressure sores, or infections that can quickly become serious health threats. Numbness, tingling or burning sensations in your feet often indicate nerve damage that can be prevented from progressing if caught early and addressed appropriately. Changes in foot sensation also increase your risk of falls and injuries that can be devastating for seniors. When 74-year-old Samuel from Miami noticed decreased sensation in his toes, his doctor's tests revealed early diabetes that was controlled through lifestyle changes, preventing serious complications. Daily foot examination and care provide crucial health monitoring that can prevent infections, amputations, and serious complications that threaten your independence and life. Examine your feet daily in good lighting, checking for changes in color, temperature, cuts, sores, or swelling that might indicate problems requiring medical attention. Test the sensation in your feet by gently touching different areas and noting any changes in feeling compared to your normal sensation. Keep your feet clean and dry, inspect them carefully after any activity that might cause injury, and seek medical attention promptly for any cuts, sores, or changes that don't heal normally. Pay attention to changes in your ability to feel your feet or any persistent pain, numbness, or tingling that could indicate serious problems. Examine your feet tonight and make daily foot checks part of your routine, because proper foot care and early problem detection are literally the foundation for maintaining your health, mobility, and independence as you age. These 7 body parts provide your body's early warning system that can detect problems years before serious symptoms appear, giving you the power to prevent or treat conditions when they're most manageable. By regularly checking your eyes, nails, skin, tongue, hands, neck pulse, and feet, you're taking control of your health in ways that could add years to your life and life to your years. The simple examination techniques I've shared require no special equipment or medical training, yet they provide health information that could be life-saving when you know what to look for and act on what you find. Tell me in the comments which of these 7 body parts surprised you the most, and whether you've ever noticed changes that led to important health discoveries. I read every comment and love hearing how these simple checks have helped people catch problems early. If this information could help save someone's life, hit that like button and share this video with any senior who needs to know these life-saving warning signs, because early detection through these simple body checks could add years to someone's life and help them maintain their independence and health for decades to come.